How's everybody doing today? Good. How are you?
It's our Friday.
Friday! Thursday, Friday.
Lift it off my shoulders slowly as we get through.
Yes, exactly.
Smile's getting bigger.
Yeah, any questions about ortho so far? No? It's all making sense? Kinda. Okay, that's great. So today, we're going to be talking about orthodontic appliances. The objectives for today are identifying common orthodontic appliances, as well as describing the use of Invisalign as a treatment modality, okay? So we already went over the Invisalign stuff yesterday in our students, like in our little groups there. So that's kind of nice, one less thing to do, right? So we'll get started with some appliances. Now, has anybody ever had to wear an appliance before? Yeah?
An expander.
Okay. Expanders.
The one with the key too.
Yeah, yeah.
Oh yeah, you have to
Turn it like water turn it.
Exactly. There's a little screw on the inside. A little screw. Yeah. Any appliances? Have you guys ever had to wear an appliance? Retainer. That's an appliance. Yeah, a passive appliance. How about you? No?
No. Mouth guard for
Mouth guard? Yeah. There you go. That's an important one too. Don't let knock your teeth out. Yeah, that's great. All right. Oh, just a couple unrelated slides. Okay, so there's me with my office. There's me in the street.
Yeah.
And
You look so young.
I was so young. And I've been working in our Bowen location.
That looks like you're on a green screen.
Our office was just super clean that day. And then here's just me with my office. He got us these nice jackets. You see David Orthodontics on them.
Hi.
Yeah, so anyway, but it's kind of bittersweet. We're closing our office, so just going through these pictures. I'm like, oh, I'm kind of sad, but
So did he retire?
no, he just moved back to Calgary, so
Oh, okay.
that's okay. He's from Calgary, so it makes sense. All of his family and stuff is there, so. But it's all good. It's the beginning of something different. I get to work with a new orthodontist, so.
When do you become like a teacher then?
In the middle of it all.
Oh.
So, just trying to do everything at once, right? Yeah, exactly.
Middle school.
Okay, so we already know all about our mallet positions, right? So, what do we have for A? Class 1, B?
Class 2, Division 1.
No.
No, that's class 1. Division 1.
Class 2.
Somebody else. Class 2, yeah.
Division 2.
Division 2, yeah.
Not Division 1 on
Class 2, Division 1.
Nope, so Division 1 is like this, right? Division 1 and Division 2. Division 1, Division 2. That makes sense? So you can think about it like that. Division 1 is like buck teeth. Division 1 is buck teeth, okay? So just remember that Division 1 is buck teeth and a weak chin, okay? And Division 2 is usually just the centrals are in lingual version and the laterals are usually labial version, okay? And then this one, pretty obvious, yeah. And then I also have just examples of all the other types of malocclusions you can have through like habits, or sometimes they're just like that, abnormal eruption, okay? Excessive spacing, crowding, open bite, deep bite, anterior crossbite, posterior crossbite, underbite, overjet, protrusion, and abnormal eruption. Okay, so you're gonna see a lot of those things, and appliances are gonna help with that in some cases, okay? So some common types of appliances. Here's a Holly retainer, clear retainer, Essex. You can also, you probably will hear the term Essex retainer. So I think it's just a name brand, Essex retainer. And then you'll also see bonded retainers, okay? So for bonded retainers, you can have 1-to-1s, 2-to-2s, 3-to-3s. Sometimes they're only bonded to 2 teeth on either side. Sometimes they're bonded to each tooth. So it just depends. It depends on your hygiene as well, on how long you keep those for. So these ones are mostly removable appliances, except for the bonded retainers, of course. So 3 major categories of appliances. So the removable retainers, what
Page 24.
Yeah, 5 and 6. So we're on 5, 24, page 24. Sorry about that. I read them out, but I didn't say what number. Just find it. Here we go. So, okay, so back to this. So removable retainers. Thoughts on what category those ones would be?
Passive.
Yeah, passive, because they're not actually moving anything. They're preventing movement rather than initiating movement. Okay. And how about an active appliance? What would, let's see what examples. So we could use Invisalign, okay? Invisalign Holly appliances with finger springs, which I have a whole tray in the back of the Holly appliances with the finger springs on them. So I'll have a look at some point. What else? So the Invisalign, I really like this picture because this is what the simulation is going to look like if you're looking it up online. So you'll probably see these, it's called a clean check. And the attachments show up as pink, right? So you have to tell your patient, don't worry, they're not going to be pink, right? So the arrows, these are the attachments. You can barely see them, right? So it's kind of nice to see. You see this little pink one? You can't even see it on there. So usually when I'm preparing the teeth to place the attachments, I'll have the simulation open just because it's super obvious where the attachments are, or I'll have the attachment template on the tray with me so I can have a look at it because the attachments are going to be in different positions and different shapes. Yes.
Do you place the attachments? Or
I do, yeah.
Oh, okay.
Yeah.
Yeah.
Yes.
Get to? Oh,
Yeah.
cool.
Yeah, so we cheek retractors,
Polish.
yeah, prep the teeth, exactly, so etch, bond, and then we actually have the attachment template with the composite inside it. So I pre-fill that, have it in a black box, or somewhere where the light can't get to it. And after the teeth are prepped, I just pop the aligner on, and then you press on the composite, and you cure it.
And that's indirect.
That is, it would be indirect.
Yeah,
Yeah,
distract.
exactly.
Oh, cool.
Yeah.
Yeah.
Yeah, so we can prepare it ahead of time, which is really nice. Yeah, so that makes it really helpful. It's actually really cool. A new orthodontist told me that as soon as you receive the trays in the mail, the aligners in the mail, like at your office, you can load the attachment template and then put them back into that little drawer, like this little drawer here. And apparently the light won't get in, but I don't know.
With the composite?
Yeah, with the composite in. I know. He said that he does that, and I'm like, really? I think he's really cocky, but that's my own personal.
You pulled it out and it was all hard.
That's my own personal opinion. I know, that's the thing. It's like I'm the one who has to do it.
Yeah.
I do have a black box that I could put them in. I will deal with that when I get there. That's the Invisalign
And they're
attachment.
just for retention, is that the buttons?
Yeah.
Like it's more,
Yep, to help with bigger teeth movements.
Okay.
So rotations, tipping, torquing the teeth, because there's so many things you can do with Invisalign now.
Mhm.
It's insane. It used to be a lot more, like a lot less. I don't even know what the right word.
like more minor cases?
Yeah, more minor cases exactly, but they're doing all kinds of stuff with Invisalign now. Yeah, it's really insane actually. Wow, really? Anyway, so it's come a long way. That's why I think it's super important for you guys to be exposed to the Invisalign because you're probably going to see it like in your offices. Okay, a lot of general dentists do Invisalign. Okay, so we're moving on to functional appliances. So I'm on page 26. Okay. So functional appliance, I should note, this is super important, that functional appliances are not used for adults, okay? Ever. Because, why do you think that is? Why do you think that the functional appliances could not be used for an adult patient?
It won't work.
Why would it not work?
Their bones are all formed up and everything.
Because,
Hold on, let me read.
Yeah, that too.
I don't know what to do
During the
growth, exactly, they're just growth. That's all it is. Yeah, no, it's I know, I'm like, I'm making you overthink it. Yeah. So the functional appliance, an appliance that alters the position of the mandible, causing stretching of the facial soft tissues to produce a combination of dental and skeletal changes. Okay, so that's a really important point, is a combination of dental and skeletal changes. Okay? Most common for the management of class 2. Occasionally class 3, but for the most part, you'll see functional appliances correcting class 2 malocclusions, okay? So examples, a twin block, let's see, a functional appliance, yeah, twin block or a bionator. So I have actually a couple really short videos. This is just a link for a whole list of functional appliances. It's actually amazing. There are so appliances out there, but my job is to teach you the most common ones, okay? So let's see, so here is, let's show you a bionator. So this is a bionator, which is also a functional appliance. Okay, so this guy has a deep bite, in class 2, so it's one big hunky appliance, right? So there we go, and then we get our patients to wear this like 20 to 22 hours a day. Look at that thing.
What's it doing?
It's training the lower jaw to move forward. Yeah. And then eventually it just all comes together. Look at that. Oh, it's class 1. Oh.
Weird.
It's not magic.
Oh,
Yeah. So very similar.
Like, how do they, sorry.
Yeah.
Do you want to start our time and just discuss it?
We can totally just chat. Yeah. That's fine.
So after, so say, yeah, the lower jaw's moving forward now,
Yeah.
how do they maintain that? They can't wear that for the rest of their lives, so.
No, so because they're growing, we're
It
actually
just grows into
we're training the jaw while they're growing.
Oh, I guess, so that's
And
why
then-
it's not gonna go back, obviously.
Exactly. Yeah. So the teeth will then, they might need braces, perhaps.
But the actual jaw will
Yes.
form.
Yeah. Exactly.
Yeah, I know.
Yeah. Yeah.
I have 2 classes. Would that work?
Depends. You probably need braces at this point.
I had braces, but I have to do.
Oh, you're missing?
Yeah, like my bottom's off and it's
Oh, midline?
funny looking.
Yeah.
Yeah.
Right? Yeah.
Yeah, and I don't like it. Yeah, Tom
You could, probably what we would do for you is either Invisalign or braces, and you would use elastics to correct your midline. Yeah, so that, so a functional appliance would work. But,
Well, I'm growing too.
you're done growing, exactly. So here's, ready for twin block? So this is a twin block, okay, very similar, but this one's a little bit nicer. So this is what we would use, like at our office, this is what we use. We never use the binators, but they still exist, okay? So with the twin block, you can also have expansion. The only problem is if you're not wearing it, it's not gonna fit. So it's 2 pieces, one for the top, one for the bottom, and there's blocks, right? So the only way you can actually close is to move your lower jaw forward and make those blocks click together, as you can see on there. And then you can do some expansion if you trust the patient, right? Because sometimes they're just not compliant, and if they're expanding it and they're not wearing it, then it's not going to fit. So you can adjust the blocks on the twin block to allow for a little bit more eruption, extrusion. Oh, and look at that, he's just class 1, so nice. Got some small anterior spaces. Oh yeah, he needs braces. He or she needs braces.
I have one like, I guess, I don't know what it's called, spacer, kind of like that on
Yeah.
the bridge of my mouth.
Yeah.
And I would turn it.
Yeah.
But it would move this way, like is it widening my mouth?
Yeah, exactly. Yeah. So that sounds like a removable expander.
And then anywhere with like that.
So we just went over the bionator. So did it look kind of like?
I'm trying to remember, I know. Kind of like that, I mean, it was all metal.
Yeah.
And it did look like that, it was all metal, and then I stuck a key in there and turned it. And then the headgear went in.
Yeah, exactly. These are like your tubes. You're like,
Yeah.
oh, the memories are coming back. Yeah, that one has a little dinosaur on it. So yeah, so bionator, went over that. So that's one big gigantic functional appliance. And so a herbs appliance. So
What are these named after?
So that's probably named after a doctor.
Like the one who designed it?
Yeah, probably named after a doctor. So they're doing an exam next door, so I'm not gonna play the video. I can play the video, but
What is that?
because it's really, the video is really good.
Is that like in there? I don't take that out, right? Is that a fixed
Yeah,
line?
that's fixed. Yeah.
Yikes. That looks uncomfortable.
It's not too bad.
Really?
Yeah, I mean, it is what it is. You get used to having those things there. So I really had to turn the volume down, so it's gonna be really quiet, but let's be quiet just for a minute.
Back another episode of Race Explained. Loving all the activity on the channel. Please keep it up. If you guys are enjoying it, make sure to subscribe so you can stay up to date with this content.
Is that loud enough?
And today's question was asked by a number of you guys, and it's about the first appliance. So let's go. So like I previously mentioned, the different classifications between class 1, class 2, class 3, the first appliance jaw is too far back to encourage it to grow forward. So to review, what we want to see is that your upper canines are fitting between these two teeth. As we said in a previous video, when your upper jaw is too far forward, this is called a class 2 relationship. And what the first appliance does is that it encourages your lower jaw to move forward. So if you can imagine, this is very important in growing patients, but isn't very applicable in the adult patients. A good way to know if you're still growing is that your shoe size is still getting bigger. What the first appliance does is that it attaches to the upper jaw and the lower jaw, and it promotes you or forces you to move your lower jaw forward, and that causes growth of your lower jaw. You have to have growth potential left, which means that you have to still be growing. So here's what our first appliance looks like when it's cemented in. And again, thank you to Tech Laboratories for donating
So that's
this
a
appliance.
3D printed model. So that's what they look like on there. You can scan and you 3D print the
You have
model.
something that goes across your upper arch and something that goes across
There's like
your lower
wax.
arch.
That's
In this
plastic.
case, we have an expander on the upper arch, which I showed in another video. So if you guys are curious about what this is, that's an expander. You can learn more about it in a previous video. And on the bottom, what you see is a lower lingual holding arch, which I'll review in the next video. But the real part of the first appliance is this telescope looking upon part of the arms on the side. So if you have a class 2 relationship, when you put this in, it forces you to bring your lower jaw forward into a class 1. Now, you'll be able to open normally and bring your lower jaw forward, but what you can't do is return it to your normal position of being too far back. This may be tough to eat and chew it for the first couple of days, but trust me, you will definitely get used to it, and everyone that has it usually is perfectly fine with it after a couple of days. Once you get past a certain age though, you can't use the first appliance because you're no longer growing. So if your lower jaw is still too far back in these cases, your orthodontist may recommend a lower jaw surgery, which would bring your whole lower jaw forward and simulate what the first appliance would do if you were younger. So the first appliance isn't the only type of appliance that encourages your lower jaw to come forward. Actually, there's a number of them, and the category of them are called functional appliances. So different types of functional appliances are the Mara, the Herbst, and there's other things that encourage your lower jaw to come forward that aren't necessarily functional appliances, like things like the Forceps appliance, which is like a spring that pushes your lower jaw forward. The importance of these functional appliances, though, is that they have to be on all the time. If you're just bringing your lower jaw forward, it won't achieve the trick. A lot of people ask, oh, why not this appliance or not? And the answer is, it's going to be needing to be in it for quite some time, at least a couple of months to encourage the growth, and a couple of more months to allow it to.
It's like if they won't wear their class 2
your
elastics,
bones
and
and
we're like, we're
everything
gonna put the forces in.
can remodel around it.
It's true, we do this.
Behind that force. So those people that ask, oh, do elastics bring my lower jaw forward?
But if they won't wear their
Not
elastic,
necessarily.
I don't see
Elastics
it,
are
right? It's just like
used
elastic
more
for the stuff.
to bring your lower jaw forward.
And then, no, I dropped it this morning and I think I broke it.
They don't necessarily.
But you know what, this actually is supposed to happen.
In
Are they able to make release? Yeah.
Sometimes the problem
Yeah, if they open too wide, like if they yawn, then they have to open really wide to
in
put
those
those
cases,
back
your
in.
orthodontist may recommend something more along the lines of a 10-year, which I will talk about in a future video. Now, in certain cases, in some orthodontists, they don't believe that these apply.
Yeah, so anyways, that guy explains it way better than I ever could have explained it. So,
How do you like clean that?
how do you clean that with a toothbrush? Yeah, it takes, and proxy brushes, like, end tufted brushes, like, a person who has braces is gonna have a whole, like, basically lineup of things that they need to use, right? Like, all proxy brushes, end tufted brushes, toothbrush, and it's all about just like, yeah, just, it's all about keeping it clean. I'm like, I don't care how you do it, just keep it clean. So, like, water pick, too, wherever I put my water picks and back, but, we recommend those, like, it's almost essential for, when you have braces and appliances, super important. So here's a twin block with 1 piece, 2 piece, right? So the problem with the twin block is, patients will commonly lose the lower piece. So it's kind of useless after that.
What about for the lower jaw, cause it's still growing?
Yeah.
Would you like talk to them about the nutrition of like things that help bone growth?
Yeah, I mean, you could, for sure, yeah, you will, all of that stuff is encompassed, you wanna monitor, nutrition and stuff, but for the most part, we're training the muscles. So that's more what the appliances will do. And then everything else is kind of like a little bit separate. Does that make sense? Nutrition and stuff? Like it's important, obviously it's still important, but it's like, it's not much, like we can't make them, you know, eat things.
So you were saying that they could try the elastics with the braces before using that appliance?
Yes, the forces.
Okay.
Yeah.
Could you do that with the Invisalign still?
Yeah, so we can't use that with Invisalign.
Like the,
But
sorry,
elastics.
elastics
Yes.
have like, would it use something similar with Invisalign for that?
Yeah, yeah, for sure. So Invisalign actually will have like little cutouts on the trays. So you can have cutouts here for the class 2 elastics.
Oh, okay.
Or you can have cutouts on the bottom for the class, like you bought a button. So a button here, cutout for class 3 elastic, and then a button on the bottom on the lower 6s, and then a cutout here for class 2.
Oh, okay.
Yeah. Question?
Would the herps be functional?
Yes.
And
Yeah,
what's
so herps is
functional
functional.
versus active?
So functional and active. So active is actually moving your teeth. Okay. So applying pressure to your teeth, moving your teeth in various directions. And then the functional is actually training your muscles. Okay, so instead of just moving your teeth, like because the functional appliances, they're not really going to be changing the dentition.
Oh, okay.
Yeah, so as you, with the Herbst, so we go back. Go back. And you can see, so we've got the expander. So the expander is going to hold everything right where it is, and then so is the holding arch. Okay? So it's not moving your teeth, it's training your jaw.
So the expander would be active, and then the herps would be functional?
Yes.
Okay,
Yeah,
thank
yeah,
you.
exactly. Yeah, so you can write those, I think they're maybe already listed as examples. Yeah. Does that make sense?
Yeah.
Yeah, so twin block, Herbst, bionator, functional. Okay. Yeah, okay, we're good on those ones? For the most part?
Does passive prevent movement of teeth only, or does it do like muscles
So
too?
passive doesn't move anything.
Yeah, so it prevents movement of just teeth?
Yeah. Yeah. So there's a list of spring retainers as well. So there's lots of different kinds of spring retainers, and I have them all actually on that back tray there. There's like 6 different spring retainers, and they look like a holly retainer. Okay. So they look kind of like this one. They look a little bit like this, but they have little springs in them. A little bit like a holly retainer. Spring retainer, and all of these ones, anybody guess what all of these are for?
Holding?
Close.
Expands.
No, oh, this one is an expander, yeah. But just all of these in general are for,
Thumb sucking?
I'm looking for a word that starts with an H. Habits, exactly,
Oh,
so they're all for habits, so habit appliances, okay? This one I found kind of interesting, so this one's actually, to retrain your tongue. So if somebody has, like a deviate swallow, like you're swallowing improperly, you have to retrain your tongue. So, one of the activities is to spin that ball, like 3 times a day for 3 times or something like that. And you like retrain your tongue. Yeah, it's really interesting. So I did a little bit of research, because I was like, I've never seen that before. Yeah, so, anyway, they've got the hay rake, which is like similar to a crib. Same kind of thing with this bluegrass appliance. These ones are to retrain your tongue. So, interesting. Okay, so these ones, you're gonna see this band and loop appliance, you're going to see the space maintainer a lot. Okay, you're gonna see that one. This is a lower lingual holding arch. Okay, so we're saving space for these missing teeth. They're not missing, we're just waiting for them. And then this is a transpalatal arch. Okay, so we're keeping things right where we want them, keeping the length of the palate. So oftentimes what we would do at our office is we would do the expansion first, and then we would place the TPA to hold everything. Okay. The Nance is also just holding things. Okay, so we place a nance if we were going to maybe extract premolars and then put braces on. We just don't want to lose any of the length or the width of the arch. Okay, so we don't want to lose any of the length or the width. We can also use it to distalize, so we put a nance in, and then we have phase 1, so brackets 2 to 2, and then open coil springs to distalize the molars. So we put a nance in, we just, yeah, kind of makes sense.
So do you put the band and loop in because you want to choose, like the tooth not to come in that space, or
You're just saving the space.
or the tooth to come in later?
Yeah. So say somebody lost one of their primary 5s,
Yeah.
and we're like the permanent 5 is nowhere to be seen yet. What do you think is gonna happen if we don't save that space? Lots of tipping. Yeah, exactly. So yeah, we just want to save that. So that brings me to my next thing here. So the space regainer. Okay, so I just wanted to get 2 different pictures for you guys. So you can see here, not a lot of space. So we've got the spring is active. Okay, it's got that big bend in it, and we always want to make sure that there's extra length. Because the thing is, once that space is made with the spring, if it's too short, then it'll just come out and there'll be springs everywhere, and you don't want that. Seriously, the springs will come off, and yeah. These ones I don't know. I think they're maybe fixed to that, but I don't know. It probably comes from a coil. So we have these open coil springs, and it's just like a big roll of them, and you measure it, just clip a little chunk, and then you put it on the appliance. Yeah, so little springs. Everything is little. Any questions about this stuff? It's pretty straightforward, right? Like say you lose that tooth too early and there's not enough space, just make a little bit more space for that. So here's your palatal expanders, and here's your key, and there's usually an arrow. Okay, so palatal expanders for skeletal expansion. So super important, skeletal expansion. Okay, dental and skeletal, but primarily skeletal expansion. So a space maintainer, just to go back just for a second, a space maintainer, remember this band loop thing we just talked about? What category would that be in here, this space maintainer? So it's passive, but it's like a preventive. So it's a preventive thing, okay? Just, I have that as a note in there, so important.
Preventive?
Preventive, yeah. Space maintainers are preventive. Because teeth are going to erupt wherever they have space, wherever they think that they're supposed to go. Here's a fun one. I just wanted to show you guys a little bit about headgear. So this is for class 3, okay? Protraction, all right? So I just wanted to show you kind of like what the different components of this would be, because it just looks like a giant apparatus, okay? So we've got this, of course, the head, forehead thing, the chin cup, adjustable bar here, okay? And so how it works then, she has an expander with like little hooks, and so the elastics will attach to those little hooks that are here and attach to the headgear on the outside. So it'll just help train her face. Yeah, so headgear, I have, let's see my note here, what did I say here for headgear?
No, I forget what it's called, but it has a band here, and then across here, and then it like locks into the.
And you don't need to know a lot about headgear, but it's just important to know what it looks like and to know what it's for.
So not terrible.
Yeah. Yeah. So the purpose of headgear to control growth and tooth movement. Okay, so it controls your growth. Sometimes modifies it in this case. So that's going to help bring the upper jaw look forward a bit. Okay. So here's what it looks like, the expander that would be in her mouth. So she's got these little hooks here. Okay, that's what the elastics would attach to. And then it comes right out, attaching to that. Looks fun, doesn't it? She looks happy. Of course, this was all in French, so I had to like go through and put everything in English. So, okay, quad helix. So I have a video about a quad helix, okay? But I just wanted to show you these because sometimes orthodontists or whoever is doing the treatment will actually take out this palatal piece and adjust it, okay? So they can actually, there's these little sheaths here on the inside of the bands, all right? So that they can remove that and adjust it. So let me show you a little video on the quad helix. Yeah. So here we go. So what kind of dental problem do you see there?
Crossbite.
Yes. What kind of crossbite?
Posterior.
Yeah, posterior crossbite. So that's expansion will help eliminate crossbites in some cases. So this is the quad helix here with the little springs. So quad helix is for dental expansion only. So it does not do skeletal expansion. Okay, it's dental expansion only. Dental, not skeletal. What's the one that does skeletal?
Expand.
Yeah, so the RME, right, or RPE. RME, RPE, they're the same thing. It just one means rapid maxillary expander, and the other one means rapid palatal expander. And then here's just different parts of braces, and I think that there's something in the notes about this for you guys. Yeah, so on page 31, there's a picture of some braces for you and just the different parts of the braces. Any questions about like different parts of braces, or is that pretty clear? Those ones that's pretty straightforward, that part.
What's a welded bracket?
Welded bracket, that is welded onto the band, I think. Let me see. Where do you see that? Oh, that's not in the book?
Yeah, number 3.
Welded bracket.
That's just a different.
Yeah, that's on your band. So the rings on the teeth, they actually solder brackets to them, or other attachments. So weld, solder is weld.
So a piece gets bonded on, and then another piece gets
Yeah.
soldered on
Yeah.
to that bonded part.
Nothing gets bonded onto the band, but the band gets cemented to the tooth.
Okay.
Does that make sense?
Yeah.
Mhm.
And then something soldered on top.
Exactly. So something would be soldered on before you put it in the mouth.
Yeah.
So it'd be
Why?
Because you can't solder inside somebody's mouth.
No, like
Yeah.
why are they, it's just another.
Oh,
why-
yeah.
what's
So
it
it
for?
depends on what kind of attachments. Like some orthodontists will like specific kinds of attachments. Some of them like buttons, the other likes sheaths,
There's just different.
different kinds of attachments. Yeah. Yeah, so that's a really good question.
Thank you.
Thank you. You got it for half a minute. And then this was just a video about Edgewise system, so I just wanted to just mention that Edgewise system is going to be like traditional brackets, okay? So Edgewise, so the wire goes in, and you actually need a ligature to go over it, okay? So it's like traditional braces. Whereas self-ligating or speed brackets, so speed brackets are actually self-ligating brackets, but that's a name brand, okay? It's like Kleenex or something. So here's the Edgewise, these ones, okay, and they need the ligature over top, and then I'll grab the instrument for this. So self-ligating, so this is like a self-ligating or a speed bracket.
So it stays shut once it's.
Yeah, so it has its own, it ligates itself, okay, so.
Instead of having a little ligature around.
Exactly, yeah, so like this, and there's an instrument to open these. Okay, so you can open it from the buccal side or the gingival. It opens all the way, you can take the wire on and off. So they don't need the colorful elastics for these ones, so it's kinda nice for hygiene, right? The only thing I'm really finding that I don't like about these is if calculus builds up on them, yuck. Yeah, you gotta get the doctor to go around it. But yeah, they're really interesting, so. So here's the self-ligating, so that's okay. So these are called the speed or self-ligating, okay? Makes sense? Kinda? This one is ligature, let's just show it. This is how the door head opens. So there's a buckle door and also a additional. But that's how it works. you don't need the elastic.
So, sorry, so the edgewise system is a traditional bracket, so that's the fixed bracket, traditional bracket, and then this one is speed brackets.
Yes, exactly. So the self-ligating.
G.
Yeah, but they have different name brands, right? So Damon is also a speed bracket. Damon is a self-ligating bracket. So is Speed is a self-ligating bracket. And we use American Ortho. Empower they're called. Yeah, so I think this must have been big when they made this quiz. Speed, that must have been the big self-ligator. Yeah, it's super cool. I love these. They're great. The only thing I really don't like about them is if somebody has a lot of calculus buildup, then the doors get stuck. So it depends. You can do either or. So there's so here's the edgewise. Okay, that's edgewise one. So the traditional brackets, right? So the wire goes in. Okay, and then you need that ligature.
Unless you do so.
And yeah, so you can either go from
Yeah, that was either like a
or there's also adjustable.
Yeah, no, the big door, like you said.
Does that make sense? Yeah. So these, all you need to know is that these are on the quiz. They're the speed. Okay. But speed is a self-ligating
I
bracket.
feel like I was.
Okay. So I think that just when the quiz was created,
This one you had a ligature on?
you could, but the wire is held in from the door.
Okay.
Yeah. So that's a
It's kind of-
self-ligating.
Oh, self-ligating.
Self-ligating. Yeah, this is the only example that I have of the edgewise, where it doesn't have a door.
Oh,
This is
okay.
traditional.
So it does have a door then?
Self-ligating.
Edgewise.
Edgewise,
Yeah.
okay.
Yeah.
Self-ligating is speed brackets that are using doors as ligatures.
Yeah.
Okay.
Yeah, exactly. So this is a self-ligating.
Yeah.
Or a speed. Yeah. It must just, but speed is a name brand. That's why it's like, okay, when I was looking at the quiz, I was like, oh, okay, I need to explain that because it's a name brand of self-ligating bracket. Does that make sense?
Sorry, you said the one with the doors is?
This is the edge. So the speed bracket.
This is speed.
Speed is a name brand.
Self-ligating.
Yeah.
Yeah, got that.
So
Yeah.
And then
the speed
edgewise,
brackets,
it's a brand name.
self-ligating brackets.
Exactly.
So you can say
Exactly. So yeah, here's so
self-ligating
edgewise, your wire's in, and you need the ligature to hold the wire in. Otherwise, it'll become disengaged.
They have the door
Doors,
that's
okay. And that's the brand name, or that's what it's actually called?
Edgewise is, I think, the system.
Okay.
Yeah, I tried to look it up because I would just call these traditional brackets, but edgewise is traditional brackets. So just think about it like that. Make sense?
Yeah.
Yes, and those are called fixed brackets used for comprehensive.
So big hygiene thing.
Are.
So if you don't need the elastics actually trap extra black. That's a really good question. I'm gonna look at So the reason we really like the self-ligating is because you don't need the elastics, because the elastics actually trap extra plaque.
Oh, really?
Yeah.
Because causing more surface.
Yeah, I think it's just the texture of the elastics. They're like, I don't know,
that would
porous
be
or
more
something.
like the doors. I feel like there's more in your mouth than I would think that would trap more.
Yeah, the plaque doesn't stick to it as much. Yeah, because they're usually metal. So.
Is this where you attach this elastic
Yes.
to stretch?
Yeah, exactly. So yeah, say you've got this and it's like elastic. Yeah. It's the little hooks. Yeah, so anyway, you can keep playing with those if you want. Have fun. I just wanted to explain the difference between the edgewise and the speed or self-ligating.
So is
Does that make sense?
edgewise,
Oh, yeah.
it's not a brand name, or it is a brand name for
I
traditional?
don't think it's a brand name. I think that that is what traditional brackets are called. Because I tried to do a bit of research on that. I would just call them traditional.
Okay.
Like, or twin. I would call them twin brackets because they have the tie wings on them.
Okay.
So.
So either twin, edgewise, or traditional. So it's
Exactly.
all the same thing?
Yeah.
Okay.
Yeah.
Thank you.
Basically, they don't have doors on them. But that's clear now? Yeah. Did you see that? So, some elastics. Just some examples of elastics. Has anybody, did anybody have braces? Nicole, you had braces, right? You had braces? Did you have to wear elastics?
Yeah.
Yeah?
The zigzag.
And then
The zigzaggy ones.
I saved mine for my hair.
Yeah, for sure. I actually have lots of patients who save them for like their baby girls. They save them for like their baby girl little ponytails. You know, like the one little sprouty ponytail. Yeah.
Those are so
Pretty cute. But yeah, just some different, did anybody have to wear a crossbite elastic?
Yeah.
They're pretty brutal.
Oh,
Like,
no.
no, not like this. So
Oh,
it,
no.
it
The
goes
pallet
from a
bit.
button on the pallet to the buckle
I
side.
feel like drill that in then, how do they get that in there?
Oh no, you bond a bracket, or you bond like a button
Onto the pallet?
onto the tooth. Sorry.
On the inside,
Yeah,
not.
palatal surface of the tooth.
Oh, that's not
Yeah,
actually on the
don't
palate.
worry, yeah, it's not one of those
Was
tabs.
there something on the palate? Yeah, we saw that.
That's
That was
a
the anchor.
temporary anchorage device.
So that's like straight up in the palate.
That's a tab, yeah, so
So that's not
sometimes we use those.
But this is better, so it's on the.
Yeah, this is a bonded bracket only to the teeth.
You can also have it without getting braces too, right? I think my brother had that.
Like a crossbite elastic? Okay, yeah, you can bond a button on the inside and on the outside. There's so many things you can do, like it's like orthodontics, it's just like, hey, let's do this, let's
Yeah.
try this, so let's bond this to that, and it's like, okay, let's put a spring there.
But he had
Yeah.
braces the last week.
Yeah.
After
Cool.
your
So just
conversation.
like correcting like a unilateral crossbite, like on one side?
It's on both sides.
On both sides?
Yeah.
Interesting.
Just the.
That's what I do.
Yeah. Very cool, very cool.
I can feel it.
Yeah, so here's an example of a crossbite elastic.
That's
Yeah, look at that one.
And then some other patterns of elastics. So there's lots of different kinds of patterns of elastics, okay? So here's just a class 2 elastic, and you can see what they're trying to do, right? They've got the elastic going from that upper 3 to the lower 6 for class 2. Class 3 is upper 6 to lower 3, okay? So class 3, the elastic's pulling like this, okay? Class 2, the elastic's pulling this way. Yeah, does that sort of make sense if you look at it? And then triangle elastics, you can use those just to close any gaps in the front. Basically, you want the teeth to fit together like gears. That's what I tell my patients, like gears.
Why didn't they fix mine fully?
You should ask your orthodontist about that.
That's embarrassing now. We'll go back.
Aww, it's not, if you're not happy.
How long?
Oh my god.
Okay, let's see, what else do I have for you guys? So, did everybody complete the matching thing?
No, I'm kind of stuck.
That's okay, so why don't we work on it for a few minutes, and here's just some lingual brackets, and then we'll go over it, we'll go over the matching thing. I know, right, we don't do these, I've never had experience with these, but they're just interesting. Yeah.
Oh, yes. When I noticed it, I almost started crying. Lingual.
So,
I'm trying to use.
But I'm like confused about the maintainer, the regainer. Oh, the regainer is when you're moving the teeth back.
yeah, so feel free to like chat about the matching thing.
Because that regain is in there. Oh, I put it on the wrong one.
Allison's face regainer.
The regainer.
This doesn't make sense. My last two is functional.
Ellis, baseball player.
I just thought they were wrong.
Because face regainers for primary.
Use the springs to regain lost space.
There are options there, so it's
Really
either.
like plastic.
What's the removal channel for wire
With
and
functional, it changes the
I
skeletal.
knew that is the Holland. But I actually don't know.
Removable retainer with a wire and retainer.
I actually saw that, so like it was in here, hold on.
Well,
I feel like I have more answers than questions.
Space regain. To regain space from loss of early primary teeth.
Binder,
Is that in here anywhere else?
changes your, like,
Oh, full space, C.
is it like,
This is C, we're wrong without, I was wrong without.
pull your bite forward or back?
C, yeah, regainer.
That's right.
Space maintainer? Reverse space on loss of teeth.
Space maintainer.
I did.
Sorry?
I did. But I don't know if that's your. I said that later on or something.
Must be that.
Is it space maintainer is removable?
It's passive, consists of band cemented tissue. Wait, I saw those on there, let me find where I saw
Yeah,
that.
I know.
I think that's the same thing as well.
Maybe you should talk to my client.
Here, oh, anterior bone, twin block, oh, that's right, 'cause that's
But
what I
it's like that one piece that they cannot move on.
Yeah, they'll be in your unit packet, you'll be able to find a lot of them.
Yeah, readjust, like. Yeah, I said that one for kids controlling the muscular.
Yeah, it does make sense actually,
Cause that's the only one that's like doing muscular.
yeah.
I watched Split last night.
No, they're not.
That movie that I wanted to watch.
Skeletal.
The app? No, Split with the guy that abducted the kid and then had the multiple personalities.
Yeah, you actually watched it?
It was rated PG-13. So I just like that and I watched it.
And it
It
was
wasn't,
PG?
it wasn't that bad, yeah. There's one part where we looked away because I think she walked in under a TV and all that.
Just not used for
It didn't actually show it. It was the Beast. They called him that personality, the Beast.
Are you serious?
You should watch this actually. They don't show anything like that.
Yeah.
I can watch it.
We don't know the story.
That's where the retainer was there.
It was
Go on.
I think if you're wrong.
It's okay, we're gonna go over it.
Yeah.
Yeah, just to make sure you guys have the right answers for studying and all that.
Biometer?
Okay.
Is there quantity? Rapid maxillary extension.
Yeah, you should be able to find most of the answers. Do you have your unit package?
Yeah, I just kind
I'm trying to do it from memory. That's good. You really tested your brain.
Like, yeah, and then that, and that's what
routine.
K for
Yeah.
quality, but.
Which I think should try.
Well, actually, that's
Oh, yeah,
like.
there's some.
Yeah.
Or wait, what was the Myers sheet?
Passive.
I just don't know what else to clear.
Oh, wait, no. What was the other one? Passive. The next one. Passive is makes no movement.
Active based.
That
I was joking at
So we want it.
Space container to present
To job.
No, because
Did
it's
you
not
do
for primary.
functional appliance?
Primary is for the space retainer.
J.
Space retainer to retain space.
It is?
No, it's just, there's one
Just
for
to
like here and
reserve
here.
space for.
Oh, yeah.
So. Just controlling muscles. What's the difference between that and D? Where'd you get D? Oh yeah, where'd you get D?
I know.
I think maintainer would maintain, no matter what.
That's what I thought too.
Wait, I don't know.
You see anyone? You just see as a space retainer, right?
Yeah.
And then you see so E. Really? I don't E anymore.
Remove control.
Holly.
Holly, I didn't know E is the one that
Yeah.
sure. But I don't. I want to space. That's the one that I want is space. I just have a wire. No, I don't do it. It's gonna have to use it. All I have is E-light, and that's for the
There's a couple of those. There's no information about it. I just Googled it. Space maintainer. Space maintainer L.
Yeah, that's weird.
Spring retainer.
It's weird that one's actually,
That one I'm not. It
oh,
wasn't.
that.
That one isn't in the book.
Oh, I said space
It's a-
maintainer, sorry. That's why.
Is this spring retainer, a removable retainer with an anterior bolt?
No. Just trying to think. Spring retainer.
Is that a functional appliance?
Because a spring retainer is active. Removable retainer with a labial bow is
With a wire anterior bolt?
a different kind of retainer. Does it say? Let me see. Where's my sheet?
I don't have any rings.
Oh my god, look at that.
I'll take it.
You guys wanna go for it?
Yeah, is that a 6?
Do you have any other ones left? Yeah.
Just like the space retainer
Yeah. So space maintainer is also your band and loop, right? Band and loop appliance?
which is
So
a 6.
why would you put a space maintainer in?
To maintain space for teeth that
For the
might not be
tooth.
there, so it wraps.
Yeah, yeah.
They don't.
So that's a sort of what it says on one of them. Where?
Let's see.
Uses.
Oh,
Similar, it's not exactly what you said, but it's like
I would say space regainer.
space regainer. Okay, do you have a question?
how come for like, if you lose an anterior tooth, how come they use a regainer but not a maintainer?
Not if you lose.
Or if you lose a, not anterior, primary, sorry.
Oh, yes, okay. Well, it depends on if you have enough space for your adult tooth.
Okay, just because you need,
Yeah.
okay.
Yeah, so that's all it is.
So that's why they use a regainer,
Yes.
not a maintainer?
Yeah, exactly. Yeah, because if there wasn't enough space, then the permanent tooth would erupt anywhere it had.
Oh,
So lingual, palatal, or sorry, lingual or like buccal. Yeah,
and it might be crowded.
exactly. It would just erupt wherever. Like teeth will come in, they don't know where they're supposed to come in if there's no space for them. If there's a retained primary, sometimes they'll erupt all over the place.
Oh, okay.
Did that help with the space maintainer?